Dr. Mate, continuing the conversation we had on BT earlier, talking about addictions and the healing process. AA, Mike Pond, Maureen Palmer have this documentary and book, Wasted, and they're talking about the merits of AA, some of the flaws that exist. What do you think is the most effective way to heal? Is it a group setting or is it more individualistic?
You know, I think what Maureen says very rightly in that book, which I'm reviewing for this weekend's Globe and Mail, is that there's no one size fits all. So everybody's different. So AA does work for a lot of people, but only a minority of people nevertheless. So that's an important form of treatment, but it's not the only one. And some people need to do it individually, some people need to do it in groups, some people need to have a combination of both. There's some things that some people can't say except in privacy. But in other situations, people can share their stories and they'll find that their stories are the same as everybody else's story. They get a lot of support from that. So it's an individual matter of what kind of treatment. It has to be individualized and it has to have more than one modality. Some people might need meditations, others might need more counseling, others might need to do yoga, meditation, body work. There's no one size fits all.
So to help determine what's needed, what do you find is the most effective question to ask someone that is suffering to find out how to help them?
Well, the first question I ask people is not what's wrong with the addiction, but what's right about it. In other words, if you have an addiction, what is it doing for you? What do you get from it? People say, I get peace of mind. People get sick, I get pain, I get relief of emotional pain. I get to deal with stress. I get to feel feel so alone. So identify what is the problem that the addiction is trying to solve. In other words, the addiction is not the primary problem. The addiction is the person's attempt to solve a problem. And so what is that problem? How did that problem develop and how can we help you with it?
Only the beginning of the conversation. Again, the workshop, who do you think you are, happening this Saturday? Thanks again.
My pleasure.
It's great insight. We've got to bring you back for more.
Thank you.